Hi, Dr. McLeod. How are you?
Hi, I'm doing good, Daria. How are you doing?
I'm good. So everybody out there, my audience, this is my chiropractor, Dr. Adrienne McLeod. She is the best,
Thank you.
located in Staten Island, New York. And I just want to welcome you today. And I want to thank you for sharing some information and your points of view about chiropractic care and how, I feel it's a holistic approach to health. And I want people to understand how chiropractic care can benefit their bodies and their mind, both. So can you tell me a little bit about your background and, basically what inspired you to be a chiropractor?
Sure, thank you. So my background, at first, when I was in college, undergrad, I wanted to be a marine biologist. and and I was working at my library, my school's library at the time, and my school was actually closing down. And I was thinking, I took it as a sign that I really didn't want to do marine biology. I wasn't really liking what I was learning. And so at my school, they had rows of books on chiropractic. And I was putting away the books, like putting them in order. You had to make sure they were in order of the little, the thing that they had. And I saw these books, and it was all about how the body could heal itself, how the body has this innate intelligence within it that, teaches it, how to heal from injuries, how to heal from disease. And as long as the body is properly functioning, then the body could do what it needs to do in order to heal. And I thought that was really interesting. So the further I looked into it, the more it kind of called to me. I was thinking, I really, really think I want to do this. And so, the more research I did, the more I was convinced. And I had an interview with my school. I took all the prereqs, and there I was. And I said to myself, if I don't like it, I'll do psychology. But I ended up loving it.
Well, they're all kind of related, right? I mean, I started out as a pre-med in biology, and I wound up actually liking environmental biology. I took an interest in that. I mean, I didn't go in that at all, but in that field of biology, there's so many variations. But I agree with you about, obviously, because I'm a health coach, about the body healing itself, where traditional medicine has a place, but I feel holistic medicine is the preventative medicine, right? Because you don't want to have that traditional medicine, right? You want to be able to prevent that from happening. But I feel each have a place, but preventative I feel is much better, that approach.
Mm-hmm.
So, but thank you for sharing that. Now I'd like to go into like a series of questions, basically about chiropractic care, to educate the audience, especially for those who never experienced what it was like going to a chiropractor. I have for many, many years. I've done it from, I did it while my son was pregnant, when people actually were alarmed that I would do something like that. But that helped me actually to have a pretty much painless childbirth, because all my bone structure was perfectly in line, the pelvic muscle and everything. So I'm really pro chiropractor. So with that being said, I want other people to understand it and its benefits. So let's talk about chiropractic care in general. How does it differ from physical therapy, right? Because they're very, very close. So how would you say it differs? And then what is the role of the spine and the nervous system in the overall health of the body? Because I think that's where chiropractic care comes in.
That's right. Yes. So I do love PT. I'm a big fan of PT. They basically, when patient goes to a physical therapist, what usually happens, at least in our healthcare system, our paradigm, is, they get a referral to a PT, and they have a specific diagnosis that physical therapist can work within. So basically, you can do one or two body parts at a time. And then the physical therapist can work on those things, but they're really not allowed to kind of go outside of it. Of course, we know that the body is all interconnected. So when they work on one part, it does affect all the other parts. But chiropractic is different in that within our scope of practice, we're able to work on the whole system, the whole body. So even though we're considered neuromusculoskeletal specialists, meaning most people view us as spine doctors, the way that the body works, all the nerves that go throughout the whole body come from the head and neck. And so when we work on the spine and when we work throughout in the joints in the body, we're affecting the whole body. So the way that plays a part in the general health of people, when you have chronic pain, and when you have acute pain too, but chronic pain is what really, ails a lot of Americans. The nervous system gets changed with that. So the nervous system is constantly, it'll send signals to the rest of the body about what's going on. It'll get signals coming from different parts saying, hey, we have inflammation here. We have a chemical imbalance here. We need to do something about this. That signal goes up to the brain, and then the brain decides, okay, these are the cells that we need to send to this body part in order for it to all work out. Sometimes those signals can get jammed up. And what chiropractic does, it's kind of like a reset to that nervous system. So a chiropractor, we're board certified as neuromusculoskeletal specialists. We're board certified, and we're able to go in and work on those parts. We're able to diagnose, treat, and prevent all of those things, depending on what we find in our exam, what we find on re-exams as patients come back. So as we do the treatments, the nervous system gets reset each time, and then the body is able to heal itself.
Okay, so people, eventually, like I go for just preventative care. So there are people that have come to you for a specific problem, and basically there's a number of treatments involved in it, and then you reassess them.
Yes. So honestly, what usually happens is people come in for a problem that they've had for years, because unfortunately chiropractors are still almost the last resort for a lot of people. So a lot of people come in with issues that they've had for years that maybe they've even had surgery on, and they're just coming because their cousin made them or their spouse made them, and it's a last resort and they expect nothing from it. But as we go along the treatments and they get a little bit better, they realize like, oh, actually, you know what? I came to you for my knee pain, but my hip was bothering me too, and now that's feeling better. And that's because everything's all connected. So the way that, that we work within the system, we'll treat something, but we work on the whole body. We always reassess the whole body each time somebody comes in, because we are all connected. So something in the knee might be affected from something in the pelvis or in the foot, and we have to check everything in order to get to the root of the problem. So basically, a lot of people, might come to me for one thing, but then they realize, oh, chiropractic can help in all different ways. So, then I become like a first resort. Then it's like, oh, you know what? Let me see what Dr. McLeod has to say. And then if I see something where I know that I can't help, because that's another thing about chiropractic, we're trained as primary healthcare physicians. So when you go through school, you have to learn how to do a bunch of neurological exams, a bunch of orthopedic exams. We even had to learn how to do a rudimentary eye test, ear test, all sorts of things. So that's so that we could refer out. So if somebody comes in and I see something like, you know what, I think you have a gallbladder issue. I need you to see your gastroenterologist, right away. We have the capability of doing that because we were trained in that. So, just as we're trained to figure out what we can treat in the office, we're also trained to figure out what we can't and what we might have to refer out to. And I think that's something that not a lot of people understand about chiropractors, is that, you can go to them for one thing. Even if they can't treat it, they know who to send you to.
That's good. A piece of information I didn't know. So that's good to know. And again, it gets back to when you were saying about you look at the whole body, it's about balance. in the body.
Yes. Yes, absolutely.
Not pinpointing one thing. It's almost like traditional medicine. They'll give you medicine, the prescription for one thing, and I'm not here to say whether that's right or wrong, but then that brings up other things in your body. It causes other things to happen, right? Whereas I think from your perspective, you're trying to balance the whole body together. You're helping them in one area, but in doing that, you're also helping the whole body itself.
Yes, absolutely. That's the beautiful thing about chiropractic, and I think it separates chiropractic from other modalities because it is a safe treatment. And, so it's kind of like a why not try it first thing where, even if we get a patient who is in chronic pain, if we get them 50% better, and then, they might need something, let's go with the knee again. They might need, a gel shot in the knee or something like that to kind of get them the rest of the way. At least we can get them to that point.
Right.
Safely.
And let's, I had a question about chiropractic care and people's misconceptions of it. You mentioned safety. So I'm going to jump to that question since you're on that topic. But, people have said, there's a lot of common misconceptions about chiropractic care. Can you debunk that? Like you said, it's safe, right? Some people are just like, oh, because, the big thing out there is, twisting of the neck. And who died because they got a blood clot or from twisting of the neck. There's all these misconceptions out there, and who knows whether it's true or not, or whether they're going to the right chiropractor. But I think that it scares people to go to a chiropractor. So what are some of the misconceptions that you've heard of, and how would you debunk those?
Yeah, that's a big one. It's called a vertebral artery dissection is the specific kind of stroke that people are talking about. And just a little bit of background anatomy. The kind of stroke that they're talking about happens in a little artery that's right in where we call it the articular pillar of the cervical spine, where the artery comes up and then goes, into the head. But basically, when we're talking about that, those people who have that specific kind of stroke, they usually have neck pain, or they have a very weird kind of headache that they've never had before. It's not a usual kind of headache. When people go to the chiropractor with that, they're already in the middle of having a stroke, unfortunately.
Oh, wow.
So then what happens is the chiropractor, might adjust the spine. They might adjust they might adjust the neck. They might adjust other parts of the spine as well. And then because that patient is already in the middle of having a stroke, whether they went to the chiropractor or, they got their hair washed at a hair salon, or they looked behind them when pulling out of a driveway, any of those things will expedite it. But that kind of stroke is going to happen, unfortunately, no matter what. And there's, they know that there's a genetic component to it, and they know that there's different environmental components to it. They're still studying it, but they've shown in different studies and different systemic reviews and meta-analysis, even there's legal journals that have gone over it, and there is no causal link. There is no causal link between chiropractic and that stroke that everybody fears. Unfortunately, it's associative, meaning, because people are in the middle of having that stroke, they have neck pain. If they have a chiropractor, they go to that chiropractor. But even if they didn't have a chiropractor, they would still have that stroke because it's already happening, unfortunately. But it's a constant thing, that you have to kind of debunk over and over again. You can't just say it once. They've done these studies many times. There was a study in 2016, a study in 2020 that, but it's kind of just like one person at a time. You just have to reach one person at a time. And to be honest with you, if you want to put dollars on it, just look at how much chiropractors spend in malpractice insurance. If there was any chance that chiropractic caused strokes, we wouldn't have a fraction of the cost of malpractice insurance that medical doctors have. So,
Wow.
Just look at the numbers and you'll see that. But chiropractic is very, 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 very safe, especially, you have to find a board certified physician, which we all are, but you have to make sure that they're board certified. And also I would suggest to people that they that they, ask word of mouth. All of my patients find me word of mouth. Almost no one finds me on the internet. It's all, hey, I went to this person, she helped me with this, maybe she could help you with that. And if you do word of mouth, you can get a sense of what the treatment is like, you can get a sense, okay, are they, more of a hands-on chiropractor? Do they use modalities? Some chiropractors use more like tools, more than other chiropractors who do more hands-on. So, depending on what you're comfortable with, you can get a sense of what kind of chiropractor you would like to go to, and one who has a good reputation based on, people who personally in your life.
Yeah, and also explain the difference between how you do chiropractic care, because way before I met you, I went to a traditional chiropractor who had the table that stretches you out and back and forth, and put like those electromagnetic things on your neck and stuff. That's like the traditional. You're more, I don't know, I don't want to call you holistic, but explain how you do things versus other chiropractors.
Sure. So my chiropractic care, it's kind of, I wish there was like one word for it, but there's really not, because I collected a whole bunch of different, seminars, lectures, all techniques that I've built over, I've been a chiropractor 15 years. So all of that time, kind of collected and brought it into one thing. But I would say that the main thing is I do kinesiology, applied kinesiology, where we do the muscle testing to see what reflex points in the body have to be worked on. With kinesiology, it is a little bit different than regular chiropractic. You usually don't learn it in regular chiropractic school. It's a post-grad certification process you go through. But what we do is, if we see that there's a muscle group that is constantly weak, we can correlate it to different organ function, and we work on specific reflex points in the body that relate to that organ, or we might give a supplement that helps that organ to strengthen that muscle on a deeper level. So it is a little bit different. It takes a little bit more time. Of course, insurance doesn't cover it, but I feel like it's the best way for me to help my patients long term, and for also so that patients don't have to come twice a week or even once a week. They can come once a month, once every 2 months, and still feel really good throughout that time that they're not seeing me. So there's so many different kinds of chiropractic out there. So that's another reason why it's really important to get information from other people who see the chiropractors as to what they do. But that's how I personally like to treat patients. Also in my practice, I do a lot of soft tissue manipulation, we call it. We don't call it massage because we're not massage therapists. We don't have that license. But soft tissue manipulation, where we're working out trigger points and little pieces of scar tissue within the muscle. Once we get that loosened, it helps the adjustments go a lot easier. So in general, I'm a gentle adjuster compared to some kind of old school chiropractors where you hear like, it's like,
yes,
they just like, it's like, whoa, with me, it's a little bit more gentle because I do a lot of the muscle work. So the body's ready to adjust when we get to that point.
very, very unique. And actually that's why, I went to you, because of your unique approach to it.
Thank you.
So, how about the physiological benefits? So, what are the most common physical benefits people experience with a chiropractic adjustment? Are there any specific conditions or ailments that chiropractic care is particularly good at? And how do those adjustments impact the body's ability to heal itself?
Yeah, so I would say that for the most part, people come to chiropractors for neck pain, headaches, and low back pain. And there are some chiropractors who specialize in those things. So if that is something that you have, for sure, you find a chiropractor who has a reputation for handling that. but we treat the whole body. We treat everything. So like I said before, when patients come to me, they might come for one thing, but they realize that, okay, everything else is being helped. So it's, it's really good in that respect. As far as other things like other conditions that chiropractic might treat, because we work on the spine and the nerves that come out of the spine go to the whole body. It's really not an exaggeration to say that everything is being helped with that. So now I've been a chiropractor for a while, so I have a reputation. So patients might come to me to help them with autoimmune stuff where, they might have Crohn's or they might have IBS, and, oh, I heard chiropractic can help that, let's see what we can do. They might bring their children. That's a big one. Because children right now, the way that the world is, and, you can blame it on different foods. I sure do. You can blame it on different foods. You can blame it on COVID because, they were isolated, but, the type of trouble focusing that kids have, trouble sleeping, irritated stomachs, different allergies, like kids are sicker than they've ever been. It's really, but kids also, because they're so, neurologically speaking, they're so plastic, they're not like set in stone. Neither are adults, but we're a little bit hardened versus kids. They respond to chiropractic extremely well. So I have, a kid who might come in and they might be bouncing off the walls, and after their adjustment, they're just sitting, they're calm. Their nervous system is just reset. It's incredible. And that's actually kind of the counterpoint with adults that can present as anxiety when your nervous system is so kind of hyper aware of everything going on, and it almost creates like a white noise in the background of your nervous system. Once we do the adjustment, when we do an adjustment, I should explain this. When chiropractors do an adjustment, we put motion into the joints, whether that's from cracking, quote unquote, we call it diversified, or activator, a little like gun that we use sometimes. Whenever there's a movement that gets into the joint, it stimulates this little part of the cell called mechanoreceptor. That mechanoreceptor sends a signal to the brain, and then the brain sends a signal back down to relax the whole system. So it really is like a reset button. It happens in the blink of an eye. It's half of a second that it takes for that whole thing to happen. But when that happens, it creates a reboot of the nervous system, and that white noise, that constant, kind of chattering in the back of your brain with people with anxiety, it's quieted. It's quieted for a little bit. Of course, then you go back out into the world and maybe you're hit with, God forbid, a family crisis or, inflammatory foods and things like that. And that can come back. But that's where, like health coaching comes into play. And, we talk through different things, what kind of lifestyle changes you need to make to kind of, quiet that part of your life down. But it really can help with many different things, chiropractic.
Yeah. I mean, it all works together. And going back to, preventative care versus, traditional medicine. If you do these, and like I'm proof, like, I mean, I went to a chiropractor probably over 30 years ago for just some neck issues. That's what started my journey, but I continued it through pregnancy and now just through preventative care. And I really think that it helps people, people that maybe even don't think they need a chiropractor. They might be surprised about how they feel after a treatment. They have no idea how much better they could feel, right? So it's something I would suggest that people put into their overall health plan as far as, and eating well, of course, and trying to de-stress. But I think chiropractic care, along with even, I go for my massages also. I think that's very helpful. Everything around holistic health. But yeah, great information. And, you know, that kind of brings us to, so we spoke about physiological benefits of all. And, you know, you started talking about anxiety and how it relieves that. So that kind of brings me into my next topic about, you know, mental health. You know, I think you started talking about it already, but, you know, what is the connection between physical health and mental health, that physical alignment of the body and the mental health? You know, you started to go down that road. But do you have any, can you point out any studies, or do you have any personal experiences with patients? And obviously you don't have to name names, but where you have seen, where you could highlight how that took effect in their journey, or stories about it, because I think that would interest people also to see chiropractic.
So in terms of studies, I know that they did a study, I think it was in Curious, but they did a study that showed that people in chronic pain, so chronic pain is defined as being in pain longer than 3 months. So people in chronic pain were 3 times more likely to have depression criteria compared to people without chronic pain. And if you think about it, you know, being in pain day in and day out, obviously it would, you know, put a damper on everything. It affects everything.
Yeah.
And it kind of almost, you know, it almost doesn't matter where the pain is, because, you know, it might be, you know, chronic headaches, but it literally affects everything in your life. It could be chronic hand pain, it could be chronic foot pain, but when the pain signals are always there, constantly bombarding the nervous system, it's really hard for your body to focus on anything else. So, you know, work productivity decreases, maybe patience with your family, if you have kids, decrease, you know, issues with your spouse, all of those things play a factor. In terms of patients I've treated, I've treated a lot of patients. Like I said before, I really, I'm usually a last resort for people. When they come in, they're like, I know you can't help me, but, you know, my sister just forced me to come and she gave me a gift certificate and now I have to do it, you know? And so, and even when, you know, they get a little bit of relief after that first time, or maybe after that second time, it creates a shift. It creates a little bit of hope, you know, something that was just something I'm going to have to deal with becomes, oh, maybe I can get a little bit better. And what would my life look like if I was a little bit better? The simplest things, people with chronic pain, you know, it can change their life if they could get in and out of their car, you know, without wincing. Just that simple little thing, or getting out of bed, you know, it can change their whole life. So, and it does it, you know, when it comes to chronic pain. See, acute pain has different chemical signals in the body than chronic pain. Both can be helped with chiropractic, but chronic pain is different because it creates actually, I don't know if neuroplasticity is like one of those words that's like a regular word or a doctor word. Sometimes I get, but neuroplasticity, in case it's a doctor word, it's the way that the brain can change the way it works, basically. So the different nerves that will tell you different things, different learning experiences, different habits. That's neuroplasticity. So chronic pain, though, it can change the different nervous system signaling in the brain.
Oh, wow.
Once we introduce that adjustment and we put those joints, we put movement into those joints, and that signal goes up to the brain, it could reset those plastic changes that happen in the brain due to chronic pain. And it has to, you know, it takes more than one adjustment, obviously, but over time it can keep resetting that signal, and then the brain can kind of calm down from that chronic pain. So it's really, really interesting, and they're constantly doing studies on it now, because it's kind of like a newer thing that they're discovering. But it has a lot of promises, you know, because that's partially why the opioid epidemic got so bad, is because people in chronic pain didn't see hope anywhere else.
Wow, that's interesting. Yeah. And, if chiropractic care could help with that and relieve stress, right? Stress, you just spoke about hormones, right? Stress,
Mhm.
just, even something as simple as your cortisol levels, right? Stress elevates those levels. It makes it harder for you to lose weight. It just aggravates any kind of stress, brings inflammation.
Mhm.
So it's just like a cumulative effect of things. So it's really important for people to de-stress, chiropractic care being one of those ways.
Mhm.
And I strongly feel that you shouldn't just go to a chiropractor just because you have it should be part of a regular program of preventative medicine, because like I said before, you may not even know you need it until after you.
Mhm.
Um,
Mhm.
but for the audience's perspective, how would they, if I first came to see you, what would I expect on our first treatment, right? What would you talk to me about? And then depending on what my needs are, would you have me come in, every week, bi-weekly, bi-monthly, or is it different for every patient? What do I expect when I first come to a chiropractor?
Sure. So the first thing I do is I kind of assess their nervousness level. Because some people, when they come in, they're terrified. Like, they've heard all these terrible things and they really don't even want to be there. And, like they're kind of scared. So I kind of have to see, are you a nervous new patient? Are you ready for this? And that kind of, it will determine where I go with the rest of the visit. So the main thing that I want to do is of really complete and thorough personal history on the patient. So, including sometimes I'm even asking about their birth. Do you know anything about your birth? Was it vaginal? Was it C-section? Was it, and kind of going up from there, because every little thing can make an impact on the body. So I like to get as much detailed information as possible. The first time that people come in, I do a pretty thorough exam. So, we do a posture analysis. I have them stand. I look at where their shoulders are. I look at their gait. I check their sacroiliac joints in the pelvis. We do range of motion of the head and neck. We do range of motion of the low back. I have to do some neurological tests, different cranial nerve tests, just to kind of make sure, nothing's crazy going on, and orthopedic tests to kind of narrow down what we could be dealing with. So orthopedic tests can tell me, okay, are we dealing with, just the pelvis being out of alignment, or is there a strain in the ligaments that we have to worry about? Things like that. Based upon what I find, I might send them for x-rays right away, or I might wait. If I think I could wait, if they're not I don't think that they have an instability, I don't think that there's, anything crazy going on, I might wait just to not expose them to extra radiation if I can handle it. With those patients, if I don't send them right away, I usually, I want them about 50% better after 4 or 5 treatments. And if they're not, then I send them for imaging. I also determine in that time, if something comes up in the neurological exam or the orthopedic exam, then I'll determine if I have to refer them out too. Because if there's a really bad joint instability, I'm going to need them to see a medical doctor who could prescribe more easily the big imaging, like the MRIs. Technically, I can prescribe MRIs, but the insurance companies give us a hard time as chiropractors, and I don't want the patient to be stuck with like a $3,000 bill. So, we try to refer out for that. And then depending on what I find in the exam and how nervous the patient is, I will determine the level of treatment that I think they need that day. It might be the littlest of tiny treatments if they're very nervous or if they're in severe acute pain. I might not be able to do a full adjustment, but maybe we could do some muscle work, and maybe we could do a little bit of like stretching moves to kind of get their body ready for the next treatment. And if that's the case, I'll have them come back sooner. If I'm able to do a full treatment, I'll reassess them right after the treatment, see where their body is, and then we'll see, depending on how much pain they're in and what I found, maybe I'll have them come back in a week, maybe I'll have them come back in 10 days, maybe 5 days, it, totally depends on that. But I will say, to go back to things that people, hear bad things about chiropractors. One thing I hear a lot is, I don't want to start going to a chiropractor because then I'll have to keep going. And it's like, okay.
But that's not
But
a bad thing. If, you know,
right. Well, and when it comes, like if you think about other kinds of maintenance, like getting your teeth cleaned,
yeah,
you don't just do it once,
right,
you keep up with it. And if you want to keep going, if you want to feel your best, if you are okay with not feeling your best, not being in optimal health, you don't have to come when, and there's patients who do that. I tell them, listen, if you come even every 6 to 8 weeks, you won't get this flare up that happens inevitably every year. But
right.
I have patients who they only come when they get that flare up, and then they're coming for 1 or 2 months straight. And then I won't see them until the following year. And that's the way they want to do it. And it's okay. I'm a part of your health team. I'm not here to tell you what to do. I'm just giving you my advice.
Instead of getting your nails done, go see the chiropractor.
And honestly, it's usually not even about money. It's usually, oh, I don't have the time. I don't have the time, like that's usually what it is for people. And I get it. It is. It's, we all have crazy lives, but do you have time to be, knocked out for the count, for 2 months while your body's recovering from this thing you always get?
Right. But even there are chiropractors who don't have medical coverage, and those that do, and even the ones that do, you're still, it's a shame because you're still paying a lot more for chiropractic care than you would be to see a regular MD. And there are people out there who don't have the money, right, to do it. Because I'll even have people say to me like, oh, you still go see a chiropractor? Why? You have back issues? And I'm like, nope, been doing it for 30 years. Well, doing it, my dad did it, he loved chiropractic care, and that's why I was open to it. So I'm not sure why people hesitate. And like you said, like I go every other month to you, right? Just for my maintenance. Every 8 weeks I go in just to get checked out. If I have an issue, I'll come in sooner for something else. But that's how I feel I help myself, right? Because if I waited any longer, those issues might creep up again. So I'm glad you brought that up. And, I just want to express that to everybody who's listening, that it's maintenance, right? It's like you go get obviously getting your hair done is not maintenance, but you have to get it cut every once in a while. And you feel that's maintenance for yourself. Or if you get your nails done, or you do this, you do go for massages, right? It's just all stuff that you should do for your health. And it's an investment in your health instead of paying high medical bills through traditional medicine. If you neglect these things, right? I mean, holistic healthcare, even vitamins. I probably spend, a couple of $100 a month just on good supplements. Because the medical profession doesn't cover that, right? It's all out of pocket. But again, if you put those things out there to help your body holistically, you prevent going to the doctors and all that kind of traditional medicine stuff. And like I said, there's a place for traditional medicine, but I feel if you practice more preventative measures, you spend less time in the medical doctor offices. That's my personal belief.
Yes.
And I know a lot of people that do that. There's more and more people now that are open up to holistic healthcare. And I even understand now in some of the medical schools, they're going to start to teach more about nutrition.
That's great.
And how you go again back to the preventative care. It's some of these doctors that come out of med school, they don't even know anything about nutrition. They have 1 semester of it.
1 class. Yeah, I know. It's crazy. It's really crazy if you look at the curriculum,
Yeah, I know. Especially, people like you and me, we're more into holistic health. It's I'm glad it's changing. It seems to be changing. I want to thank you for coming today, first of all. I mean, I've learned so much, and I'm sure everybody listening has learned so much. So just some final thoughts. Anything else you want to give to the audience? Any valuable insights? Any advice you want to give anyone that's considering coming in for chiropractic care? And then finally, where can people reach you? I mean, obviously you're in Staten Island, New York. how could people reach you, either telephone or email? But just some final thoughts around anything else you want to add, and your contact information.
Thank you. So yes, I would like to add, for patients who are dealing with something and they're waiting for it to go away, or if they were dealing with something and it did go away, I would still recommend that they go see somebody, because the body is really adaptive, and the body will kind of like, kind of make phone calls to you and tell you about pain up to a certain point. And then when you ignore it, then it can go away, but that doesn't mean that the injury is not still there, or that the body's not just dealing with it quietly. So definitely just make sure to still get checked, even if the pain goes away, because just because, the pain's not there, it doesn't mean that the injury is not there. And I will say, if you're trepidous about chiropractic, just keep, looking at different physicians in your nearby area, and getting, looking at their reviews, making sure they're board certified, and also getting opinions from family and friends who have seen chiropractors, because the person to person, kind of contacts, that's the best way to find somebody. That's the best way to find any physician, in my opinion. And as far as how to contact me, there's my email. It's drmcleod@drmcleodhealth.com. My website is drmcleodhealth.com. The best way to get me is definitely email. I don't really have social media because I am word of mouth. So I don't really, for my practice or personally, I really don't do social media. So really, email is the best way. My office phone number is 718-635-2142. You can reach me there through text as well. But thank you for having me on and giving me the opportunity to shed some light on things.
Oh, I mean, great. I even learned, I know you for so long, but I even learned more things now. Because I always have our chats in the office. So,
Yes.
so now I even learned more. And I think you gave some valuable insight into chiropractic care, and so excited to share that with other people. So I want to thank you very much. And I am sure I will see you soon.
Yes. Thank you. Have a good one, everybody.
Again, bye.
Bye.